Our next speaker is Dr. Michael Rowe.
So thanks everybody for being here, and I'd like to also thank Rita Stern, George Strimmel, and Dr. Daniel Lee for helping setting this up, and of course all the volunteers for taking their time to be here today. So a question that I get asked, really, I'd have to say if not every day, then at least every other day is, can I use marijuana in my glaucoma treatment? And this is a question that is not going to go away. It's a valid question because certainly the word is out there that marijuana can be used in glaucoma treatment. Many of my patients have heard this. They are interested. And again, it's time to address this and hopefully give some guidance on this commonly asked question. So as Dr. Lee just discussed, the reduction of intraocular pressure is right now the single modifiable risk factor in which we can try to reduce somebody's risk of having progression of their disease or risk of developing the disease. And as he already said, there are multiple risk factors, but once more, reduction of the IOP remains the one that we can treat. And reduction of the IOP has not been shown just clinically. We don't just find this just in our own office, but it's also been shown in multiple major trials, such as the Advanced Glaucoma Intervention Study, the Early Manifest Glaucoma Trial, and the Ocular Hypertension Treatment Study. So the treatments to reduce IOP include medical treatments, and at current time, there's roughly 4 major glaucoma drug classes, 5 if you count an older drug called pilocarpine. And so when we give you various drops, we're essentially giving one of these 4 commonly used classes, sometimes in combination. Now, if that's not effective, or sometimes alternatively, or in additional therapy, we can also use lasers. There's lasers that are used to treat some forms of glaucoma, and they can be effective. And when medical treatment and lasers are maybe not enough, we can also go to surgery. You'll hear more about the drops later. You'll hear more about surgery also from Dr. Moster. I'm sure that'll be exciting. However, mainly when we're talking about drops, we talk about compliance, and you may hear us use this term now and then. The compliance, that means, is the patient using their medication as directed? And we know from multiple studies that compliance with glaucoma drops can be poor. So patients may report that they're using their drops, and frequently they're not. Now, there's multiple reasons for this. Sometimes it's just a matter of not able to instill the drop properly, and Dr. Kohlenmeyer is going to talk about how to put your drop in your eye. And it's more challenging sometimes than you might think. The bottle can be difficult to manage. Sometimes it's hard to really know that the drop gets in your eye, and you'll hear a little more about that. But of course, there's other issues with drops, including cost, the burden of taking more than one drops. And we know that with each additional drop that we give a patient, so in other words, another prescription, the compliance drops. And that's, of course, because the regimen complexity increases, and it can be difficult to use multiple drops, to remember when to take what drop and when, how to properly space the drops. Some patients don't know this. So again, compliance or sticking with the medical regimen decreases. And as you see to the side here, here's a picture of somebody who's having an adverse response to their medication. Some people can really have angry red eyes with drops. It's just a common side effect, and it's seen in upwards of 10% in some types of drug classes, that you get this red, angry, itchy, watery eye, and that's obviously going to make you not want to take your drop. Because after all, as Dr. Lee just mentioned, glaucoma is a disease that most people don't realize they have. There are really no symptoms, as he said, even late into the disease. Most people are not aware of their visual field defect, as he just demonstrated with those brilliant slides showing how people's brains can fill in all that information. So therefore, what's the benefit therefore? If you're taking a drop that makes you feel crappy, pardon the language, but why would you want to take it? So that sort of falls to the wayside. And of course, the disease then is at risk of progression. And of course, socioeconomic issues play a major role in noncompliance. Again, the poverty, socioeconomic status, racial issues, and what have you, may decrease one's compliance with using the medications. So again, getting back to marijuana, this is reasonable to say, well, is there a role for marijuana? Well, we do know that it can lower the intraocular pressure by up to 25% in roughly 60 to 65% of glaucoma and non-glaucoma patients, and that is similar reduction to many of our drops. There's a dose-response relationship, which could be useful. For instance, that means that if you inhale or however you ingest a little bit, you get a little response. If you inhale or ingest more, you get a larger response, and that could be useful. You can imagine a patient that needs a little intraocular pressure reduction may not need to take as much as somebody who needs more. So dose-response relationship could be a useful factor in many kinds of glaucoma medications. This mechanism of action of how does it lower the pressure is not entirely understood. There's a blood pressure lowering effect with marijuana, rather, and there's some thought that the intraocular pressure may go along with that. And there's also what's called cannabinoid receptors that are present in the ciliary body. This is the gland inside your eye that makes the fluid. And there's a thought that maybe there could be an interaction there that may reduce the amount of what we call aqueous, or the fluid inside your eye that's being produced. So that's the way it might work. So as medical marijuana becomes more and more common, as you can see here, the majority of U.S. states, 29 of them now with D.C., do have legal medical marijuana. So as this becomes more prevalent, there's going to be more interest in using this for their treatment of their disease. So in our area, Pennsylvania, New Jersey, and Delaware actually do have medical marijuana bills or laws passed. Ours is called here in Pennsylvania, PA Senate Bill 3 is where it started. It was then signed by the House and then signed into law by Governor Wolf on April the 17th, 2016. This allows for a 30-day supply. And it has the restrictions on how it may be dispensed. It's mostly dispensed in almost all forms, except for a leaf form. So in other words, they're trying to, I guess, sort of, in some respects, cut down on sort of a recreational use. So you're not allowed to give in the leaf form, but pretty much every other form is allowable. Now, the allowed diagnoses are actually quite broad. And as you can see here, on the left side, halfway down, glaucoma is one of those allowable diagnoses. So there it is. It's right in the bill that you can use this to treat your glaucoma. And obviously that creates some confusion because, well, if the bill says it's so, well, how come, doctor, aren't you giving me this? And there it is. And there's other things that are also used for medical marijuana. Now, we've known for a long time that marijuana can reduce the intraocular pressure. I kind of enjoy this old study from 1980, rather. And I like the spelling of marijuana. I guess at some point there was some alternative spelling. This one has an H instead of a J. And so this is a study out of Washington, D.C., where they actually had two groups. One group had a marijuana cigarette, and the active component in marijuana is called, let me get this right, 9-delta-tetrahydrocannabinol, and we call that THC. And so the active intoxicant ingredient is also the ingredient that reduces your intraocular pressure. So there's a lot of stuff in marijuana. Like many plants, they're full of different compounds. The one that causes the reduction of pressure is not separable from the mechanism of causing intoxication. That's an important fact. So anyway, you had these marijuana cigarettes and you compared them with placebo. How did they make a placebo? They basically took the marijuana, soaked it in alcohol. It extracted the THC. So it still kind of smelled, and to the patient seemed to be marijuana, but it just didn't have that active ingredient. This was 18 patients, many of which had glaucoma, actually all of which had glaucoma, and they were smoking the cigarette compared it to placebo. And you can see here that it did indeed reduce the intraocular pressure in this study, and you can see that the peak effect was around 1.5, 2 hours or so after smoking the marijuana cigarette. Compared to placebo, no effect, which is no surprise, so it definitely showed an effect, about 6 millimeters of mercury, as I discussed before. The blood pressure went down. And in some cases in this study, pretty significantly so, and some people were actually hypotensive, and they had some issues with that. Hypotensive means your blood pressure is so low that you actually can be dizzy when you stand up. So marijuana caused a reduction in the blood pressure, and placebo did not. The side effects, and people may be aware of this or not, but some people had anxiety. Tachycardia was something a feature that made some people feel kind of poorly. Some people had tachycardia, palpitations, postural hypotension, meaning they stood up and they felt kind of weak and dizzy. Alterations in sensorium, hungry, thirsty, euphoric, drowsy. Some people said they felt cold. And one of the big things, and again, this is something that may turn some people off for using this, a lot of people had red eyes with marijuana, which is, again, pretty well known, but it's important that people that would be interested in taking this realize how they might look with it. So now I'm going to zoom forward now. This is 2010, and the American Glaucoma Society felt the pressure to issue a position statement. Now again, this is 2010, and since then, medical marijuana bills have been progressing in all these states. This is sort of a little bit before all these medical marijuana bills did progress, and I think it's important to read this, and it's what I was showing you earlier. It has been definitively demonstrated and widely appreciated that smoking marijuana lowers IOP in both normal individuals and in those with glaucoma, and therefore might be a treatment for glaucoma. Less often appreciated is marijuana's short duration of action, only 3 to 4 hours, meaning that to lower the IOP around the clock, it would have to be smoked every 3 hours. And again, here's the problem. Right now, the way to get the marijuana into your system to lower the intraocular pressure is either to smoke it or to eat it. and both of which would cause intoxication. Now, people wonder, well, is there another way? Can't we make a drop out of this? The problem is it has not been possible so far to make a drop out of the active ingredient THC. It has a low water solubility, and that's important with medications. You have to actually, when you make a drop, it can't just, it's simple to make a drop, but the drop also has to get into the eye, so it has to penetrate the cornea. And in this case, it doesn't do that. And other applications like an oil-based were found to be very irritating. So far it cannot be medicinalized. Of course, the adverse effects, as I mentioned before, and this would also include with drops, you have a red eyes, that's what we call conjunctival hyperemia. Short duration of action, this is important to dwell on. Again, if you're having a medicine that wears off in 3 hours, you're having to take it frequently. And as I mentioned before, this is a medication that would also cause you to be intoxicated. So you're really running the risk, if you're going to treat your glaucoma, of having to smoke a marijuana cigarette or eat some kind of ingestible form of this every 3 hours, okay? Every 3 hours. Not only could that cause dependence, now marijuana is considered to be a medicine that people can develop a dependence upon. It's not necessarily like a narcotic where there's, certainly a very high addictive and other dangerous possibilities, but dependence has definitely been shown, including even some withdrawal symptoms if you suddenly stop it, if you are dependent upon the medication. Of course, impaired mentation is well known, and more importantly, impairment of motor skills, and for instance, operating a motor vehicle, functioning at work, all these things would be impaired. So again, I just reviewed all this stuff about marijuana. Saying about this, I would have to say I would not recommend any of my patients use marijuana for their treatment of their glaucoma. The medication is somewhat effective, but not necessarily more effective than the drops. It has a lot of downsides and side effects, and its duration of action is so short. There's not a single medicine in a drop form that we give you that has a duration of action that short. I mean, can you imagine if I gave you a drop and said, use this 8 times today? 8 times? I mean, would you want to take it? I don't think many people would. So, these are some of the problems. But yet, the medication marijuana is increasingly, I'm being asked increasingly more about why can't I use this? I think part of it is trust in sort of a natural treatment. Marijuana has sort of an imprimatur as a natural treatment. It grows, it's a leaf, it looks natural, and patients like that. They like something that seems more natural than sort of a synthetic drop or medication that they might get from a pharmacy. On some level, perhaps there is a distrust in institutional medicine and perhaps even a distrust in their care provider. Like, why are you giving me this? Why aren't you looking for alternative therapies? And that's just a fact. And so maybe we're not doing a good enough job sort of making a relationship if a patient is also wondering why can't you give me marijuana? So we have to be clear about why we're treating them and how we're treating them and what the goals of our treatment are. In Washington, D.C., again, another study out of Washington, I don't know why the marijuana studies are out of Washington, D.C., but here's another one. There was a survey of marijuana use. And this survey came out recently, 2015, out of the group from George Washington. And this survey found a few things. When they initially looked at the survey, they had the survey about would you use marijuana. They asked a bunch of questions for these patients. Patients were volunteers to do it. The response rate was around 65%. So not everybody answered the survey, but many did. So it seemed like younger people would be more interested in it. People who had maybe a lower level of education and people who had used marijuana before showed some interest in using marijuana to treat their glaucoma. But as they sort of delved down and sort of sent their data through a bit of a blender to kind of really bring to the top what the most important factors might be that would cause people to be interested in using marijuana, one of the biggest, and this is important, was the perception of legality and acceptability. So as more states are passing legalized marijuana for medical treatment, more people are interested in it because they figure, well, if it's legal, then why shouldn't I try this? So that's an important thing. So this is going to become more prevalent. The patients are going to be asking us more and more about marijuana use. Again, false beliefs about marijuana use for glaucoma treatment, meaning people think it's actually more effective than it is. So there's a thought out there that the drops are okay, but marijuana, I've heard, is really great. And that's something that people have a belief on, and that would drive their desire to take marijuana and they may hear it from a friend or a family member about marijuana, and they're more willing to trust that person and say, okay, I want to give that a shot. If you're dissatisfied with your current glaucoma treatment, and I showed you the picture of the patient with the red eyes, I mean, that might want you to say, try something else. Hey, this drop makes my eyes itch and burn, and I hate taking it. Let's try marijuana. And it is interesting. I mean, drops do have some side effects. It's not without issues. For instance, I put in an allergy drop yesterday. My eye felt all gummy. I thought, you're actually feeling gummy with this? Imagine taking this every day. I mean, it is an issue. Patients have to deal with this, and they have to deal with this frequent dosing. And finally, if a how much does the medicine cost? Some people think marijuana might be more cost effective. Now again, that may or may not be so, but if marijuana is considered more cost effective, some people might be more willing to try it. So those are the main factors that would drive its use. I would like to conclude with the conclusion of the AGS position statement, because I think it says it very well, what we should be telling our patients. Although marijuana can lower the IOP, its side effects and short duration of action, coupled with a lack of evidence that its use alters the course of glaucoma, preclude recommending this drug in any form for the treatment of glaucoma at the present time. Thanks, everybody.